Good morning, everyone. We'll start today's Metro COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. James Hildreth, President and CEO of Meharry Medical College, and Erica Long, librarian at Thurgood Marshall Middle School. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll begin with Mayor John Cooper.
Good morning, Nashville. Give me a moment here to unsnap my mask. Now, as of today, the majority of our public health metrics are satisfactory, but case numbers both here and across the state are slightly elevated, prompting us to stay today in Phase 2 for our roadmap for reopening Nashville. The level of cases in southeast Nashville warrants further attention, and I've instructed the Public Health Department to concentrate its efforts in a more focused response in these neighborhoods. So we will continue, hopefully just a little bit longer, with Phase 2 while carefully observing our public health data every day. Now, Dr. Alex Jahangir is present today and will have more details about these metrics momentarily. Our goal is to protect the health of all Nashvillians by carefully and deliberately continuing our phased reopening plan. I know many of you may be worried by this temporary delay in our roadmap progress, but please remember that we are doing everything possible to keep our community safe as residents return to work. At more than 7,100 tests per week, we're well above our current test capacity goal. At the outset of the coronavirus, we had 4 contact investigators. Today, we have 120. Our hospital capacity remains adequate for both our city and our region, and we've engaged our community partners to perform outreach and education in area hotspots. But your full participation and cooperation is essential to keeping us moving forward. Please remember to practice safe social distancing, wear a face covering in public spaces, frequently wash your hands, and remember to call the Metro COVID-19 hotline at 615-862-7777 if you are exhibiting symptoms of COVID-19. Remember, all assessments and COVID-19 tests are free of charge to Davidson County residents at all 3 of our community assessment centers. Now, earlier this week, I announced a $24 million investment from our Federal CARES Act Relief Fund to assist distance learning for our public school students. Metro will provide every MNPS student in Nashville, Davidson County with a laptop and internet access to help bridge the digital divide that most often affects historically underserved neighborhoods. This morning, I want to welcome Erica Long, librarian at Thurgood Marshall Middle School, who's here to discuss the importance of this investment in reaching and engaging our public school students as our MNPS educators navigate the unique challenge of distance learning. Erica is a dynamic and creative educator, and I'm grateful to her for her joining us today. And also, as always, it's a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's with us to discuss the coronavirus and its effects on our community and our ongoing response to the virus. As always, the COVID-19 Response Fund is available to those seeking direct financial, food, mental health, and social service assistance at the Metro COVID-19 website. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Nashville and Davidson County. We now have 6,627 confirmed cases. That is an increase of 56 cases in the past 24 hours. We did have 1 additional death yesterday. We now have 80 residents who have died because of the coronavirus. And again, my sympathies are always with their family and friends. Of the confirmed cases, 1,437 cases are active in our city. As a reminder, 1 month ago, in fact, I think 1 month ago exactly today, active cases numbered 1,763. That means we have 326 fewer cases active today than we did earlier in May. And of the 5,110 cases, or 76% of all cases, have recovered and have been cleared. Now, as the mayor mentioned, we have decided not to enter phase 3 yet. Today's numbers of new cases is better than what we have had the past few days, but our rolling 14-day average is slightly increasing and hopefully showing signs of stabilizing. As we continue moving forward, we will evaluate further data and watch it over the next several days before we make a decision. Now, the number of cases continues to be higher in Southeast Nashville. In fact, over this past month, nearly 50% of new cases are from that area. Furthermore, our contact investigations have shown that more than 85% of cases in that area had a relevant exposure to the virus in the home as their most likely source of an infection, meaning not through community spread. In my capacity as chair of the Board of Health, I have directed the Metro Public Health Department to concentrate on the southeast part of the city to isolate the virus, to help reduce the spread, and through these efforts, I believe we have achieved some success. Members of the community have accessed testing at the assessment centers in a large number, and we have partnerships with community organizations to expand our educational outreach, including accessible and instructional videos on assessment center use and testimonials from recovered cases that address the realities of COVID's impact. We have also invested and expanded in our contact tracing resources to get a better picture of the virus in our community. Now, these efforts in this area are starting to show a positive impact, and cases in this area are slightly coming down. But there is more we need to do to protect our residents in these communities. The Public Health Department will work with the Mayor's Office, the Metro Council, and community leaders to expand and implement a more aggressive plan to address this issue. This plan will include more community-based testing through testing strike teams, as well as other interventions. We will also explore providing food and housing security to those who need it so that they can self-isolate and slow the spread of the disease. Now, I want to be very clear. This pandemic is not a Southeast Nashville problem. The data we use is based on where a person who is tested lives, not where they work, not where they shop, and not where they may go. We have seen the virus affect almost every part of our city, our region, and our state, and not just a few zip codes. And while we may focus on this area, we want to continue to work to slow the spread of this virus throughout our entire city. Another point I need to make is that while we remain in phase 2 for now, this does not mean that we're regressing or that we have to go back to phase 1. It just means that we are staying at status quo for a little longer and watching a few more data points. Now, remember, the 3 community assessment centers are open 5 days a week, including today, from 9 a.m. to 3 p.m. And you can always call our assessment hotline at 615-862-7777, 7 days a week from 7 a.m. to 7 p.m. if you have any questions or concerns about this virus. Now, just remember, I still need you to continue wearing your face mask. The face covering protects others, and as Dr. Caldwell says, it's a sign of respect that you're showing others and not just for yourself. And also remember, please stay 6 feet apart and continue your hand hygiene protocols. I really appreciate everything you have done, Nashville, to help flatten the curve. It really has gotten us to a really good place, and I know we'll continue to advance in our roadmap to reopen and to get back to where we need to be as a city. I now would like to introduce Dr. James Hildreth of Meharry Medical College. Thank you.
Good morning, Nashville. A couple of days ago, the World Health Organization caused a great deal of angst among public health officials and some confusion among the public when they stated that transmission of COVID-19 by asymptomatic individuals is relatively rare. They've since tried to clarify that statement. But to be quite honest, they didn't do such a good job in that clarification. So I'd like to make the point as emphatically as I can that asymptomatic individuals can and do transmit COVID-19 virus. And we need to distinguish two important categories of infection. There are individuals that are truly asymptomatic and individuals that are pre-symptomatic that manifest as being asymptomatic. So it is well documented that some individuals who are infected by COVID-19 virus do not develop symptoms at all during the course of their infection. They are truly asymptomatic. Some of these cases have been revealed through serology testing in which a person tests positive for antibodies to COVID-19, but to their recollection, they never had symptoms whatsoever with the virus. These individuals are truly asymptomatic. In the United States, we don't know the true frequency of these individuals because the testing has been somewhat limited. And when we have a reliable, sensitive serological assay, and we do widespread testing with that assay, we'll have a much truer idea of how frequently asymptomatic infections occur. We have to know that everyone who develops symptoms from COVID-19 will at some point have the virus without symptoms, and we call this a pre-symptomatic or prodromal phase of the infection. In other words, whether it's a few hours or a few days, everyone who had symptoms were pre-symptomatic before they had those symptoms. And we know with certainty that during that time, these individuals are highly contagious and they spread the virus to others. And that is why it is so important, as Dr. Jahangir said, that we wear the masks, because they protect us from getting infected and prevent us from transmitting the virus to others. That is why the masks are so very important. Yesterday, the country crossed an astonishing milestone in the COVID-19 pandemic from my perspective. Imagine this, that over 3 months, every person in Nashville, Memphis, Knoxville, Chattanooga, Clarksville, and Murfreesboro, all 2 million of them were infected with a potentially fatal virus. That would certainly get everyone's attention, I would think. That is what has happened in the United States. 2 million Americans have now been infected by the COVID-19 virus. The actual number is probably higher than that because the limited amount of testing that we've done. The other number that's equally sobering and astonishing is the fact that more than 114,000 Americans have died from COVID-19. These numbers reflect the tremendous toll that the virus has taken on our communities around the country and remind us that the virus is still with us and still capable of causing great harm, great devastation, and unfortunately, a lot of people will die from it unless we take steps to stop it. I, along with other infectious disease experts, have a great fear that the rallies and marches that have happened recently around the country are going to cause a spike in cases. This fear is enhanced by the fact that we're reopening the economies, and quite honestly, some people are doing it better than others, and some people are following the mitigation steps better than others. So, those of you that have participated in recent marches and rallies, I strongly encourage you to get a COVID-19 test, whether you think you've been exposed to the virus or not, because that will help us keep the virus in check. And a special word to African Americans in the community who might be listening to me. Most of the people who participated in rallies who've come to get tests are white. We need everyone who has participated in the rallies and marches to get tested. Because again, the virus is no respecter of races, genders, and all of that. So please, if you participated in these events, please get a test, because that's going to help us keep the virus in check. So, we need to be vigilant, be reminded that more than 1,000 people a day are dying still from COVID-19. It's still a great threat to all of us, and we need to do all the things we need to do to keep it under control. So Nashville, we got this. Please don't be a vector for COVID-19, and we can put the virus behind us. And with that, I'd like to turn it over to Erica Long, the librarian from Thurgood Marshall Middle School. Thank you.
Good morning. Thank you, Dr. Hildreth. I would first like to thank Mayor Cooper for his commitment to provide devices for MMPS learners, allowing us to become one-to-one. This is a tremendous leap forward in every child receiving an equitable opportunity to excel in the classroom. Even more, providing internet access for families who cannot afford it bridges digital and socioeconomic divides, ensuring no learner experiences moments where they cannot complete assignments due to lack of resources. As an educator who has previously served in a one-to-one school, I have witnessed firsthand the type of enhanced engagement teachers and learners can take part in with the addition of digital resources. Mayor Cooper's and MMPS's strategic investment in digital resources allows all 89,000 plus of our learners to be future ready, equipped with 21st century skills, including digital literacy, and the ability to personalize their learning. When we talk about being forward thinking, providing rigorous learning, and meeting every learner where they are, providing each of them with technology and the proper skills to utilize the technology is part of the equation. So thank you, thank you, thank you.
Thank you, Ms. Long. We'll now begin taking media questions, starting with Adam Tamburin at the Tennessean. Adam, you're on the air.
Hi, I have a question for Mayor Cooper. I wanted to get his reaction to a resolution circulating among council members calling for Chief Anderson to resign. I know he put a statement out saying about changes he wants to see in law enforcement, but I wanted to ask Mayor Cooper if he supports Chief Anderson and what his responses are to the council members' concerns.
Thank you, Adam. Mayor Cooper.
Well, thank you, Adam. I was looking, of course, with great interest in the non-binding resolution. In part, I believe it's non-binding due to civil service protections for department heads in Nashville, which is a little bit bureaucratic way of saying it's not really up to a resolution process. But last week, I took my brother's keeper pledge, and just to spend a moment on that. That's about reviewing, engaging, reporting, and reforming our police practices so they have the full confidence in the community. And we're doing that right now with a 360-degree evaluation of policing and public safety policy and practices. Now, Nashvillians deserve to be safe, and including those who are making their voices heard in public spaces. I'm grateful that there were no injuries in the recent era. That is, I think, a credit to the professionalism of our police department, and I do want to acknowledge that. But we can do better. Everybody can do better. I think people will be reassured when we get to the bottom of our policy review that we have been better, but not good enough. And so, again, in keeping with my brother's pledge that we talked about last week, we're in the review and engagement part of the process, and soon we'll be getting to reporting and reforming with positive steps forward for our community to be really a model community for our country.
Jeremy Finley at WSMV.
Good morning. Thanks for taking our questions. You've spoken quite a bit about the importance of wearing the masks. But when you review all of the complaints that have come in since phase 2 began, the majority of them are about employees not wearing masks. So my question is, given the uptick we've seen this week, will the city begin to enforce and begin citations, and at what point? And what do you say to people who are frustrated that have made complaints about employees not wearing masks at businesses, but no citations have been issued? Thank you.
Thank you, Jeremy. Dr. Caldwell.
Thank you. Good morning. The goal that we have is to assure compliance. Issuing fines and citations is not the goal, but it is part of a continuum of educating the community. Now, Nashville-Davidson County is doing something special. We are requiring signage in front of every business to assure that everyone should wear the face mask, and we are requiring that employees wear facial coverings. That does not exist in all of our perimeter counties, so we're doing something extra. We have identified 33 establishments that, after communicating with them more than once, still seem to not be complying. And over the next week, we will be visiting them, and if necessary, we'll be making sure that they comply. And citations and fining is a part of that.
I would like to make a comment about that. We, as members of the community, can have an influence here. If you go into a business and you don't feel that that business respects you by having the employees wear a mask, turn around and walk out. And I assure you, at some point, the business will have their employees wearing a mask. If we don't patronize those businesses, they will have no choice but to comply. So I'm just saying that from my perspective, we as customers have a powerful influence on this. That's what I've been doing. When I walk into a place and the people aren't wearing masks, I turn around and I walk out. I encourage you to do the same.
Thank you, Dr. Hildreth. Nancy Amons at WSMV. Nancy, you're in the air.
Thank you. I have a question for the mayor and two questions for Dr. Hildreth. The question for the mayor is, has the city been relaxing its policy on musicians, especially the two on stage at a time? And for Dr. Hildreth, do you think that the data sharing policy is hindering efforts in Southeast Nashville? Also, a second question for Dr. Hildreth. How many protesters have you seen so far testing positive?
So the first question is about the data sharing policy in Southeast for Dr. Jahangir, and then Dr. Hildreth, the question about protesters testing positive. Relaxing on musicians. Yes.
Thank you, Nancy, and I may get Dr. Jahangir to address that further. The musicians' policy has started out at 2. It has now been modified, working closely with musicians, event spaces, and the public health department to where it is more flexible, but still allowing the practice of social distancing. So this will depend on distance between musicians, and then they're working with the equipment to do it in a safe way. There's nothing per se, obviously, dangerous about music. And so this is Nashville. I am hopeful that the rules that we've established here will be a national model for live music to be conducted safely. And it'll be a credit to us to show how to do it the right way.
We don't have the data yet as to how many of the protesters that have been screened are tested positive. We have been taking random data, getting random questionnaires for folks of which zip codes they're from, their race, and those kinds of data, but we don't know how many of those individuals are have tested positive. But let me also say that in those zip codes where you see the hot spots, where there's lots and lots of cases, I just want to let the community know that testing in those areas are twice on average of what they are in the other zip codes. So I think there is a focused effort to address those areas where the cases are so high. Just want to put that out there. As in terms of data sharing, there's no evidence that I'm aware of that that's been an impediment for getting people tested. I think that we're now asking or informing individuals that that is going to happen. And as you know, the health department has made a commitment that after 30 days or so that those data will be deleted from the record. So I don't think that so far the sharing of the data with the first responders has been an impediment to testing, because testing overall has been really high in Nashville compared to some other places. And I think we're all excited. I'm excited about that the level of testing is what it is.
Kara Hartnett at the Nashville Post. Kara?
Hi, thanks. On the more concentrated efforts in Southeast Nashville, are you considering putting that area on its own track to reopening? And I know you talked about more testing, education, and contact tracing in that area, but are there any other larger, unique mitigation efforts you're considering?
Thank you, Kara. Dr. Jahangir?
Sure, thank you. There's no plans to have a separate Southeast reopening plan. So that sort of answers your first question. Second thing is, I think, there's testing efforts that is part of it is education. So we have partnered with organizations, Church Shalom, so forth, to increase education. And as Dr. Hildreth has mentioned, a large those zip codes that are highly impacted by viruses have also had increased testing, which is good. But I think we need to perhaps look to do we need to do further, maybe mobile testing and other more even directed efforts. Beyond that, we're looking at other innovative ways to maybe make it easier for people to self-isolate at home. And I like to develop those a little further before I just throw out random ideas here. And so maybe the efforts specific to that area need to be amended some, but that's Nashville. I want to highlight this, and this is not just a Southeast problem, but it is Nashville, and we will stay on the same roadmap to reopen, whether you live in North Nashville, Southeast Nashville, or Southwest Nashville. So thank you.
Elizabeth Lane, WKRN.
Hi, good morning. Thank you for taking my question. So Dr. Hildreth touched on this a little bit, talking about protests, so I think he or Mayor Cooper could possibly take this question. But we've seen thousands of people exercising their right to protest. We understand that there's another demonstration planned for July 4th. And so we've been getting lots of questions into the newsroom about why the city is allowing and is in some instances encouraging people to come downtown to protest. And this is drawing large groups, but people are wondering why the city can't move into phase 3, have 4th of July fireworks, things of that nature.
Thank you, Elizabeth. Mayor Cooper?
Well, I'll come first. Part of having 120 contact tracers is that you begin to know a lot about the disease. Right now, there's no evidence that the demonstrations themselves have led to any additional outbreak in the disease. But we'll ask. I mean, it's a theoretical possibility, but there's no evidence that that is the case in Nashville. And most of the protesters have been wearing masks, not all, but the compliance has been relatively good. Now, in terms of having the protests, it's all part of life in the pandemic, right? People have constitutional rights. You can't suspend the constitutional rights due to a pandemic. If people want to peacefully assemble and bring to the attention of the government and to each other vital problems, they, I believe, are allowed to do that. Now, I have encouraged them to wear face masks, and in my experience, they have. The 10,000 person march, I think, was an inspiration to, and that's last Thursday's march, and nobody knows the exact count, but it's a whole lot of people. And of course, it's a concern. And we really do need everybody to strictly adhere to social distancing and face masks. But the Constitution is not suspended with the pandemic, and people have basic rights to go forward, and we want to honor those rights. We want everybody to do that safely. We also want to listen to the message. I think everybody in the community understands this is a deeply felt message that we need to hear. And that's how we're trying to proceed as a community. These are challenging days to get it all right. But again, let me go back to that original question, and again, let's talk to the Public Health Department frequently about that, but there is no evidence that the protests has added an additional new case. but we have to be on it every day. We are close to getting into phase 3. You do have a lot more outbreak with the state too. And we just want to honor the hard work that everybody has put into this to doing a great job. Look at where our caseload is. This is unthinkably good at one point, but let's finish the job and remind each other not to be a vector.
Nayeli Alamia at 96.7 FM. Nayeli?
Hi, good morning. My question is for Dr. Caldwell. Governor Lee announced that the face mask distribution will resume. Can you give us an update on how soon we can expect that distribution in Davidson County? Thank you.
Thank you. Dr. Caldwell?
Yeah, I was pleased to see that news coming from the state and the EPA, and I'm grateful for the guidance that we've gotten from the Tennessee Department of Health and the Governor's Unified Command for reviewing this, for providing these facial coverings. And we're right now reviewing all of the information. I'm working with the mayor's office, Chief Swan and Fire and EMS, and my team at the Department of Public Health, and we'll probably provide more specific details in the next few days. It's important that people remember to continue to wear any facial covering that you have, but I believe that we will start giving out these facial coverings again, and we'll have the plan to you soon.
Brett Kellerman at the Tennessean.
Morning, everyone. Dr. Hildreth mentioned during this press conference that he recommended protesters get tested for coronavirus. However, I think it was at this exact same press conference about a week ago where Dr. Jahangir said he did not believe that mere attendance at the protest warranted testing. I'm curious if this is just a matter of differing opinion or if Dr. Jahangir has changed his position. Is there a consensus on if protesters should be tested or not?
Thank you, Brett. Dr. Hildreth.
My opinion has not changed, and my opinion is shared by many other healthcare experts. Then we have thousands of people in close proximity to each other with a virus that has a prevalence somewhere between 1% and 5%. Many people not wearing masks, yelling at the top of their lungs, creating aerosols. There's a great possibility that someone who came to the rally without the virus is going to leave the rally with the virus. So I am recommending to all the people that I know who participated that they go get a test. Not so much to protect themselves, but to keep the virus from going home with them, infecting someone who might have a worse outcome than they would have. That's the point that I'm making, that the science tells me that when you have hundreds, thousands of people in close proximity, not wearing face coverings, yelling really loudly, it's a perfect storm for getting the virus transmitted. So I believe people should get tested. So that's my opinion. It hasn't changed.
And Brett, thank you. I would be curious as to the wording of the question when I replied, to be honest, because I think I said, if you're worried about the virus, get tested. But with that being said, I echo what Dr. Hildreth is saying, and I still echo what I'm saying. If you're worried about the virus, I phrased the scenario, I believe, last week, and I have to, again, go back and look at it exactly. But if you're worried about the virus, get tested. All right? The risk of getting tested is very minimal. Get tested. Now, if you're a place where you're wearing a mask, you have 6 feet social distance, you're outdoors, that's an environment that makes it less likely to have disease transmission. And that may be how I worded that question. Again, I don't remember the exact wording. So I echoed what Dr. Hildreth is saying. If you're in close proximity, you're not wearing a mask, people are yelling, get tested. If you're worried about the virus, get tested. Or if you just want to know, get tested. So I hope that adds some clarity, but thank you for that opportunity to explain.
Brad, I'm happy to go back and look at that tape with you and consult with you off the air. Blake Farmer at WPLN. Blake.
Yeah, thank you. I just wanted to get a little bit of color on this. Dr. Jahangir mentioned that, there was no sort of risk that we might go back to phase one. And I didn't, obviously this has all been an evolution. At one point we were talking about needing to have numbers, declining for 14 days before we sort of moved to next phases, and that seems to have gone out the window. So my question is really, is the reason we're not going back to phase one because we don't need to, or because it's sort of would just be untenable with Davidson County residents?
Thank you, Blake. Dr. Jahangir.
Yeah, Brett, I'm sorry. Blake, thank you for that question. We don't need to go back to phase one with the data we have. As I've always mentioned, is we look at all the data at all the times. Okay, so let me explain this decision, why we're not rolling back right now, and also why we're not rolling forward. So right now, the hospital capacity in Middle Tennessee is, I believe, 22% of hospital beds are open. I think 23% of ICU beds are open, give or take. There are 98 individuals as of yesterday afternoon when I checked this number, admitted to hospitals in Nashville with COVID. Now, they may be outside of Nashville residents, but they're 98 individuals. So our hospitals are able to tolerate the capacity. So that's one metric. Testing capacity has been good. Our positive rate has been, I think, 9.6, the numbers that we just posted on the website. So we have a reasonable surveillance of this virus in our community. Our public contact tracing, as the mayor mentioned, is good, and it's allowing us to see where the issues are. When it comes to, so I would push back a little when you say we just thrown it all out of the air. We haven't thrown out our guiding principles, and we've always said it's been more than just one number. So I guess I'm just saying we're just pumping the brakes still to continue evaluating some of this data a few more days. If heaven forbid things went horribly wrong and all of a sudden we have hundreds of people in the hospital and the hospitals don't have capacity and mortality rate has gone up and just things just have gone really off the rails, then I think we would evaluate if we need to really pull back to a phase zero again. But we're not there at this moment by any means, and hopefully looking forward we won't ever get to that point. So I hope that answers that question. Thank you.
Actually, and Blake, if you didn't mind, let me just add to Dr. Jahangir's answer. A couple of things to keep in mind that I think are encouraging. The total current active cases has actually declined in the last month. Well, that's a powerful fact. Our health capacity modeling is actually very good. At one point in this disease, the health capacity, the model for that was clearly going to lead to problems. Dr. Jahangir mentioned tests, but let's also mention transmission rate. That in terms of being in control of the disease, that is still at 1. It's not where we would like it to be, of course, but that's very good. So those three aspects of the data, I think, add to the community's confidence that we are making progress as a community. It is not perfect, of course, and the volatility of the daily case reporting, it's a little bit like the stock market. It's hard to read on any particular day or week, but fundamentally, we have made excellent progress consistent with our goals for that. And I want people to feel that their hard work has resulted in this, which it has, a stable transmission rate, which is limiting the growth rate of the disease in the community, and that the current total active cases is declined. That's a fantastic statement. And again, I want to thank people in Tennessee for their hard work, and every day they put on a mask, every day they wash their hands 3 or 4 more times. And it's an accomplishment, and we need everybody to stay at it. And then also we have learning how to use tests. In terms of the earlier conversation, let's use tests to allow us to do things in a safe protocol. We, at one point, had almost no testing capacity. As we build testing capacity, and hopefully we double it from 7,000 a week to 15,000, let's learn how to deploy tests to allow additional safety. And again, Dr. Hildreth's point about demonstrators being tested, well, we should all have a routine where we think if we are tested, need to be tested, let's go test, because we have the capacity to do it now, and that will allow us to further expand and get back to normal.
Those are all the questions today. I'd like to thank Dr. Hildreth and Ms. Erica Long for joining us this morning. The next scheduled Metro COVID-19 press briefing will air on Monday, June 15th at 9:30 a.m. Daily updates will be posted at covid19.nashville.gov. Thank you for joining us. This concludes today's press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.